Diagnosed with lichen sclerosis and feeling a little bit lost, or you're not quite sure what to do, or maybe you've had some advice and it hasn't really worked for you, this video is for you. So we're going to be covering what lichen sclerosis is and then kind of what the treatment managements might be, including physiotherapy intervention. So first of all, lichen sclerosis, if you don't know a detailed explanation of what it is essentially an inflammatory skin condition that changes the vulva, the perineal, or the anal tissue. So you get scarring, it often is thinner, it can appear pale in appearance, and the sensations that you get as a result of this is often itching, burning, pain, sharp stabbing sensations around the vulva, vagina, and perineum, but also then you might get pain with things that the pelvic floor is responsible for. So things like opening your bladder, opening your bowel, having intercourse, those sort of things. It can often get misdiagnosed as well. So often we see a lot of these patients who have been going through the process of trying to get diagnosed and they've been misdiagnosed with things like chronic UTIs, thrush, bacterial infections, particularly if no one's actually had a look at the area, which is surprisingly more common than you would imagine. And then even if somebody has had a look, sometimes the changes, particularly at the start of the disease, can be quite subtle, or they might be missed, particularly in a younger demographic, or in somebody who's postmenopausal, which is when this condition is more prominent or more common. It can sometimes be mistaken for just low estrogen tissue. So getting an accurate diagnosis is the first step, and seeing a gynecologist who is really skilled in this area can be a really good person to have on your team, or a really skilled pelvic floor physio and a women's health GP. So once you've got an accurate diagnosis, often the first medical management will be a corticosteroid treatment, which is basically just like a topical ointment that you put on the tissue, and often this is a long-term treatment for the condition. On top of that, there's other things that you might change about your lifestyle and go down the route of kind of changing diet or exercise habits, and then you might also visit somebody like me who's a pelvic floor physio to help with the symptoms that can occur from the condition, and also to help keep the vaginal canal and the actual vulva tissue nice and elastic, because with the scarring that you can get from lichen sclerosis, it can cause tightening around the vaginal entrance, the perineal body, or around the anus, and that's where I come in. It can also affect your bladder and your bowels, and then also how you have sex. So that's my role, which is what we're going to focus on today. So if you have seen a pelvic floor physio and they've maybe identified that you've got lichen sclerosis, or somebody else has diagnosed that, you will normally start with a treatment program based on your symptoms. So if you come to them with, let's say, pain with intercourse or burning and itching, then your treatment might look a little bit different. So I'm just going to talk very generally about what the treatment options might be, and specifically about how we use dilators for long-term management of lichen sclerosis. So if somebody's coming to me and they've got pain with intercourse, maybe some burning, some stinging, maybe some pain with urination, but the main finding that we get on assessment is a tightening or a narrowing of the vaginal entrance, or maybe it's just thinning of the tissue around that area, then normally somebody's starting with a dilator program. The reason we do this is because dilators obviously are smooth cylindrical devices that increase in both length and in width. And with lichen sclerosis, over time, what can happen is that the scar tissue makes the vaginal canal smaller and smaller and smaller, and so penetration becomes more difficult. And when it becomes more difficult, it also becomes more painful. It can be painful just purely because of the scar tissue and because of the condition, but it can also be painful because if you've got pain in an area, your pelvic floor muscles tighten up in response to that pain, and so you might get an exaggerated narrowing of the vaginal entrance just because your body's having that fear response and tightening those muscles. So we are both trying to relax the pelvic floor muscles and let them open a little bit more, as much as we're trying to stretch and release that scar tissue. So if somebody's having that pelvic floor response as well, then often dilators are fabulous, and same with scar tissue, because we just want to gradually stretch that tissue and stretch those muscles like quite slowly. If somebody's just got scar tissue restriction and maybe it's quite a specific area, then you might use a wand to do more targeted treatment at the entrance or towards the perineal body. So it does depend, but generally speaking, most of my clients at some point in their journey will use dilators. So let's say you're currently having pain with one finger. We would choose a dilator, normally a size 1 or a size 2, that is about the same size as my finger. And if you're having pain with a single finger exam, we would always start at a size 1, because you always want to go one size below what is currently painful. But let's say for argument's sake, we're using a size 2. What this would do would be to gradually stretch the vaginal muscles and the scar tissue at the entrance, and then also train your body to relax while something's in place. So you often do a series of breathing exercises, of relaxation work, and we've got very specific exercise videos about how to do step-by-step dilators, which I will put here. But essentially you would teach the body body how to relax and open. When somebody gets to a size that they need to, so let's say for argument's sake, your partner who you're having regular intercourse with is this size, you would get to this size and then maybe even the size above to make sure that your brain is well and truly aware that you can handle this size, so there's no fear response to this size. Somebody with lichen sclerosus might then need to do a maintenance program of these two sizes on and off every week, every other week, once a month, it really depends on the person, in order to make sure that that scar tissue and that pelvic floor muscle stays nice and relaxed. So dilators for people are often a long-term program or thing that they will be doing, more regular at the start and then less regular as treatment goes on. Not everyone needs them forever, but a lot of people will be on some sort of maintenance program. So that's what we normally want to do locally to the area. If you're getting pain or discomfort with things like riding a bike, sitting, wearing certain clothes, wearing certain underwear, your physio might also talk to you about how to manage those things by using different surfaces, making sure you're having cotton breathable undies, making sure you're not wearing tight clothing all the time, etc., etc. But from a direct pelvic floor point of view, that's normally what we want to do. The other really important things is to do some regular breath work and mobility. So when we talk about breathing for any sort of pelvic floor relaxation, we want to make sure that you can let the belly go. So you really want to think inhale, exhale, inhale, exhale, inhale, exhale. And you can see how my belly really bulges. Like, I am not pregnant, although it does look it, but you can really let go of your belly when you take an inhale, and then when you exhale, you squeeze pelvic floor on and you slightly tighten your core to let that breath recoil before you then breathe again and really let your belly bulge. So taking regular belly breaths throughout the day is not only going to help your pelvic floor relax, but it's also going to downregulate your nervous system and really work on getting you out of a flight or fight response, which can cause pelvic floor and jaw and glutes and tummy all to tighten up by themselves. So that's kind of how we would manage lichen sclerosus from a very specific pelvic floor point of view. If you had then constipation as well, or pain, burning, irritation when you're wiping after a poo, we would obviously be working on those things as well, but that's kind of out of the scope of this video. But if you have any more questions, if you want me to do more videos specifically about this topic, please let me know below. Otherwise, hopefully this has been helpful and you can find more information on our website